For anyone who's considering stem cell therapy for their specific situation, it really makes sense to ask how effective is stem cell therapy. And I would say when it comes to biological therapies, when it comes to cellular therapies, when it comes to really potentiating your own biology for healing, whatever it is that's ailing you, be it knee pain, hip pain, shoulder pain, some form of neurologic injury. There is nothing better than stem cell therapy, and that's not just my opinion. That's studies that have compared stem cell therapy to more conventional therapies such as knee replacements or meniscal surgery or disc replacements in the back. The advantage time and time again goes towards these natural products. It goes to stem cell therapy, and it makes sense. Look, if most people, and this is what happens for the most part in this country, if someone goes to their doctor and they're complaining of joint pain, for instance, the typical cocktail there is to be prescribed Tylenol, be prescribed anti-inflammatories, be referred to physical therapy or an orthopedist who will inject various substances into that joint, including steroids, which over the long haul can do more harm than good. And ultimately, all of those roads lead to the same place, which is invasive, irreversible surgery. And that includes things like joint replacement. And I think what most patients, what probably a lot of doctors fail to realize is that what that translates to is the patient trading in one set of problems for another. They're certainly trying to mitigate the discomfort that they're in by exposing themselves to medications that are either addicting or have significant side effects, including organ failure, or they go under the knife and essentially they are limited in other ways. It's not unusual for me to encounter patients who are in their 40s, in their 50s, fairly young, who've undergone joint replacements. And a few years ago, a few decades ago, that was a big no-no, but it's certainly become more and more acceptable. And now the patient's in a situation where they're not able to engage in the type of activities that brought them a lot of joy in the past, and they still have several decades to live, several more decades ahead of them, and it's significantly altered their lives, their lifestyle, their outlook on things, and that's too bad because maybe they weren't aware of these other alternatives that were there. And so, like I said, I believe really strongly in this form of therapy, in stem cell therapy. I've dedicated my career to it. I love the people who I work with here at our office, the staff, the patients. They bring me a lot of joy, and it really helps me to see my patients improve. Having said that, stem cell therapy is not for everyone. In fact, we turn away more patients, more potential patients than we accept. Probably, I'm guessing out of 10 patients who reach out to us, we turn away 9 of them, believe it or not. We really want to stack the deck in our patient's favor. And that's really important, regardless of what form of therapy someone is considering. The healthier that individual is, the better off they are. And so we're pretty selective about our patients. And so if someone is overly reliant on certain types of medications, be it opiates or benzodiazepines or anti-inflammatory steroids, NSAIDs like ibuprofen, where they just can't put it down, and it's something that they've become dependent on, become reliant on. If they have other conditions, such as heart disease, such as kidney disease, liver failure, liver disease, metabolic disease, such as diabetes. Those are all things that we really shy away from. We don't want to institute this form of therapy, which admittedly is not cheap, but ultimately, to take their trust, to take their financial investment in trying to get better, and ultimately, do a procedure where maybe they're not at their healthiest. It doesn't help them over the long haul. And I've had plenty of those types of conversations with patients. And there are some patients that are understandably very disappointed in that. And I can certainly empathize and sympathize with their position. But stem cell therapy is not for them. There's certainly patients that I've strongly discouraged because of all those factors that I just mentioned, and they choose to go forward with it. And I've, in some instances, been pleasantly surprised. But I'm very upfront about the effect of comorbidities, the importance of being really diligent in the post-injection period for the ensuing 3 to 4 weeks to make sure that they're not overexerting themselves, putting too much pressure, and risking subsequent injury to that joint or to wherever the stem cells are have been deployed. So all those factors are really, really key. As I said, of all the therapies that are out there, stem cell therapy is the most effective. Not my opinion. That's what the medical studies have demonstrated in really intricate ways and great ways that I take a lot of pride in. I'm happy that I'm engaged in the type of work that I am, and keeping that in the back of your mind. Also, knowing that you as a patient obviously also are invested in trying to make these types of injections, these forms of therapies, a success. And to do that, as I said, it pays to have a really good relationship, with your doctor, where you're able to follow instructions, and the doctor is able to explain why those instructions are really important. And also for the doctor to be very selective about the type of patients that they take on, so that way we're each getting something out of it, and it's a sort of a symbiotic relationship in that way. To briefly summarize, it's stem cell therapy is something, as far as the question of whether it works, yes, it works. Certainly above and beyond any other alternatives that are out there.